So Somalidu inay therapist aadaan way ku adag tahay. Why?
What therapy does for you is it helps reprogram your brain to come back to safety in ways that it's not wired in now. And so therapy is going to help you. Therapy is not a magic pill either, you guys. Therapy is not a magical thing. I always tell people, don't come in here and expect to make me work magic. That's not how it works.
Waa maxay trauma?
haddii aad haysatid waalid oona safe ahayn oo dhaqan kuugu yeeraayo oo yacni ku nitpick gareenaayo oo criticize gareenaayo maskax oo yacni hadda ay tahay maskax develop gareynayso ma laga yaabaa intay disho ma laga yaabaa.
Of course. People my age and older, they see kufsi, they see mate, baabuur laga dhacay, qaarkood waxay dhaheen anagoo kismaayo marayna Kenya socon qofaa libax naga dafay. On top of the baabuur pickup car, libax came and ate one person and we left. There's so many stuff.
PTSD is the response of how your system responded to the significant event or the life-altering event.
Cunuga yarkaayo kaleeto hooyadiis ay ku dhihi jirtay doqon baa tahay, nacas baa tahay, fulay baa tahay, aabihii iyo hooyadii iyo macalinka dugsiga ay ku dhihi jireen. Asagoo lama soo dhiil gareen dagaal iyo waxaas.
So the importance of 0 to 5 years old bini'aadamka u sameynaysa waxyaalaha ay ka mid tahay waxa waaye the sense of self, the development of the sense of self. Waa qofka shakhsiyadiisa intuu ogaado. Who am I? يعني how important am I to the people around me? يعني who listens to me? يعني do I have a voice? We have been robbed of developmental milestones that are imperative for child development. And so I say this now because as I'm learning and I was healing and doing my own work with this education.
The trauma, it happened, right?
Yeah.
So how it affect our relationships, such as marriage friendships, trust, everything.
Yeah.
Sida u saameynaysaa trauma.
Many ways.
Many ways. You didn't had focus on that because ilmaa ku sugooyo. Family aa lagu joogo Soomaaliya. Lacagaa send out garane. Shaqadaada shaqaysane. Dee Joyce maada lahayn, luxury-gana maada lahayn. Laakiin hadda meeshas ma joogno. Because taas waan fahansanahay.
If we have a choice, waxaa leedahay marka imaan hospital baan aadi lahaynba.
Yes. Why? Exactly.
Asalaamu calaykum waraxmatullahi wabarakaatu. Ku soo dhowaada xilqadan caaway Moon Media. Maaragtay noqon doonta qayb barnaamijkan Moon Media ka tirsan oo really maaragtay aad iyo aad muhiim u ah because waxaanu haynaa caawa qof la yidhaahdo Dr. Abyan Bashir oo ayada isu kiin sheegi doonta maaragtay first time aan isku keenno Say-Life generation highly educated qualified professional ma fahmaysaa same age mahadla ah ma fahmaysaa
Safab guys.
No fresh of the boat Somali ku koray first generation right. So Abyan came here, ayada sharxi doonta iyadoo little baby ah, studied here, become maaragtay professional and maaragtay psychologist. Waxyaalo badan marka waxaa jira dadku naga maqlo mahad marka qaarkood ayuu aniga iga maqashay anoo ka hadlaya mental wellness, mental illness, trauma, all that stuff. Waxayna qofkii professionalka u ahayd waana soo tuuraynaa waxaan ku tuuranaynaa English, Somali and Somanglish.
Somanglish. What did you call it?
Some English.
Labadeenna
we good. Abyan baa xujaysan caawa.
Waxaa rabnaa ayada she's on the spotlight. Meeshan waxay ku jirtaa. Waxaa artay ku hadlaysaa. Caawa marka permission aan siino waxaan nidhi Somali English meeshay kaa soo gaadho sii daa. Ma fahmaysaa? Wixii qaraxa waale mahad baa ka shaqeynaya habeenay. Ku soo dhow mahad.
Who is Abyan?
Assalamualaikum.
Alaikum salam.
Okay. Hi. I feel like I am put on the spot, but who's Abyan? My easy answer is I'm just a girl. I'm like just a girl, okay? Yes. But by profession, I'm a psychologist. I have a doctorate in the study of psychology and the human mind. I've been in the work of the helping profession for a long time. Prior to this, I have a social work degree, which I practice quite a bit of clinical social work in my past life. But nevertheless, I came to this country when I was about 3-ish years old.
Yep.
I want to say the war and all that bad stuff happened prior to, before the age where children remember. So childhood amnesia. I don't have any recollection. So I would consider, from a technical standpoint, you would consider my generation 1.5ers. And the reason it's called 1.5ers is that you came to the country before you were an adult. However, I like going by the APA definition of 1.5er, which is 12 years and younger. And the wisdom behind that.
What's ABA?
APA is the Applied Psychological Association, or
Psychological
Association
Standard
of Psychology. Yeah. And so the reason this is significant, and I think it's important, is because as you can think about it, if somebody comes to a host country before the age of puberty, they are going through a developmental stage that's quite significant, whether it's in their home country or if it's in their host country. And so the reason I like going by the APA definition is that it categorizes 1.5ers as those who came to the host country 12 years and younger, because their identity development started after they had migrated to a host country. And so the reason why I would say Mahad and I have a different experience in the ways that we may show up culturally has to do with where he spent, the years of his adolescence, meaning when identity formation was happening is usually during, adolescence and puberty. So he spent it maybe back home, and his development, the ways that he's organized is a bit differently than myself, who has here. So I would be considered 1.5ers. But anywho, continuing on who Abyan is, I'm a 1.5 Somali American. Asagana waxa loogu yeeraa and first-generation immigrants. So first-generation immigrants are people who were born in another country, who came to a host country and started working, whether they came as adults or not, right?
Correct.
Like, of course, it means that they came as adults. That's first generation. So you would be considered first generation. Yeah. He would be considered first generation. 1.5 are those who came, if we're going based off of the APA definition, 12 years and younger, because identity formation happened here versus back home.
And then kuwinta ku dhashay maxay noqonayaan?
Second generation, third generation, fourth generation.
Anaga nagu sii xigaya. Okay, Abyan waxaan rabnaa caawa inaan ka wareysano cali aniga adiguba anagoo si wada jir u wareysanayna. She's therapist, right?
Yes.
Family therapist.
Yeah.
So
I'm a psychologist, which means I treat families, children, couples,
as
everything.
A therapist.
Yes.
Therapist. Gotcha.
So Soomaalidu inay therapist aadaan way ku adag tahay. Why?
And maybe we do know that.
Yeah.
Aniga waxaan ku adag tahay kelima xataa ardadeennu kuwa iskoolada ku jira. Xataa badanaa ma arkin dad balangareyna inay psychologist noqdaan, ama for every 200 girls ama boys nursing raba inay noqdaan. Waxaa laga yaabaa one inuu jiro psychology dhahaya. So weli go-aankaas ma umalaynay inaan gaarnay baahiba inay u jirto. Xoogaa inay weli daciifnimo tahay oo in qofku uu qof kale kala hadlo hawlahaas. Marka adiga professionally maxaa kuu soo baxay?
So ani waxaan dhihi lahaa two perspectives a meesha jirto. Meesha, and one perspective waxaa waaye prior to industryga galay ma ogeen amba waa la yaabnaa taloba waa u diidayaan oo maxaa jiro, right? iyo haddii anigiyo soo arkay shaqadii oo aan a couplena dad ii imaadaan aan hadda ogaan karo more ciladaha jiro oo haysta communitygeena. So hadda markay noqoto horta hore anaga dhaqaniyan waxaan u haysanaa, and the way that we deal with conflict from a cultural standpoint intay kala duwan tahay. Culturally, before we came to the West, ideas was what you went to the elders in your community. So you went to your tribal leaders, or you went to a family member, and in a family there was always either a matriarch or a patriarch, right? Somebody is coming in to deal with that situation. This culture, this idea where you are leaving your extended family and tolkaaga iyo dadkaaga oo stranger aadaysayo problemkaaga oo la soo hadlay. Waxaas wax oo anaga noo jira weligeed ma ahayn. However, I think that people would let you know that there is some wisdom and some knowledge and power in that. Here in the U.S., in fact, people would prefer that they take their problems to people and professionals who may have the expertise and the knowledge to be able to help them understand and discern what is going on, right? They don't necessarily have to attach any stigma to it, because dhaqaniyan saas bay ayakaba weligood u jireen oo saas bay hoosha u qabsan jireen. Laakiin anigayaan imaano muslimiin ah oo weliba haddana wadan oona muslim ahayn, oo haddana nala dhahayo issues kanba vulnerability u leedihiin iyo depression iyo waxaan baa jiro iyo PTSD jiro, now you have to go see somebody. I could understand the resistance markay dhinacaas noqoto, and so I hold that for my people and I hold that experience. However, the piece about it that makes it even more sinister, that I think disencourages or maybe disempowers people from actually going to get the help, is that immediately people recognizing that if they go see somebody, they must they must have wali. They must like waxba ka qaldan. يعني حتى انت ogaadaan therapist qofka maxaa loogu tagaa mawaali basa jirto information kaasna ma jiro somaha soo qofkii haduu fahansan yahay xataa aniga marmar waxaaba dhahaaba what a disservice is it to you intaan yani xataa bila aadanimo aan dhahno qofkii ama waa fiyo yahay ama waa waalin yahay because waxay meesha dhan ka bixisaa human experience ka marka ani taas ila tahay for the reasons why a lot of people in our community don't come out and ask for therapists because the stigma and it's kind of awkward. It's not something that our community is used to and they hear these things at home and within their house.
So su'aasha aan rabaa weydiiyo marka waxaan labadinooda ka weynaa so one experience ugu weyn arka waxa weeye annaga markii waxa qofku uu qabo la fahmi waayo hal god oo weyna ku gurnaa qofka markaa fahmi weydid dhaqankiisa waa xiran yahay.
Do you understand that Somali?
I'm following.
qofka markaa dhaqanka qofka markaa waxaa ku waraartay samaysiin abrasion iyo waxaas anaga ma naqaan waa xiran yahay waa la ilaysta may fahmaysa markaan dhaw hadid maaragtay see ku ogtaa sixirku waa jiraa lagu leeyahay waa la sheegay qur-aankiisa rasuulkuna waa sheegay salaatu alayhi wasalam laakiin meesha dhibaatada tahay waxa waa see ku ogaan kartaa inuu wixii halihii kaloo dhan la hubsado soo maaha inaan marka professional markaa dadkii la fariisanaysa hadda waxaa moodaa dadkii makula tahay Soomaaliyeed inay soo aqbali doonaan terabiga soo fahmeen maadaama shaqada aad u qabatid bise weli istigmadii waa taallaa
horta saa aniga hadda in this work waxaan ku jiray and I would say adiga 10 years xoogaa waa ka badan tahay like 11 years 12 years and wallahi to be honest alhamdulillah and mashallah I am seeing a lot more Somali families seek out services and I think that a lot of it has to do with the fact that they are up against some very, very hard, difficult things. And the things that eventually push them to essentially think differently about the ways that they have been thinking about mental health has to do with the fact that, you know, there's a loved one that has probably fell into addiction and there's been eons and years and nothing is helping. And now that person is experiencing significant mental health issues, maybe even SI or just homicidal issues, like just things that makes them feel like, whoa, I need to get some help. They need some help, right? So it kind of gets them out of that comfort zone. Another thing is, again, mothers who experience postpartum, right? And so we've experienced quite a bit
What's postpartum means?
Postpartum is an essentially a psychological experience that can happen after women, mothers give birth. And so I can't quite give you the stats right off the head, right off my head right now, but there's a significant portion of women who, when they specifically, even in our community, I've seen it anecdotally quite a bit in our community, is that women would have children, and after they have children, they have this experience where postpartum depression makes it really difficult to take care of yourself, take care of your newborn child, have what feels like that mothering experience. And of course, when you're a mom who has so much shame with these experiences that you're having, rather than getting help, people are actually falling into pretty scary situations. I mean, where moms have actually hurt themselves. So all that
marka taas inay keento maadaama aniga waxaas anoo qualify mani soo maama daa gabar qabtida cunug ay dhasho oo ani aan ogeyn waxaas postpartum marka the effect soo maama maskaxdooda
postpartum depression
waa depression
way saameynaysaa
laakiin aniga marka lay person aan ahay wixii aan aqoon soo ma dhahay naagtan waa waashay
Yes, and haddaad weliba an emotional intelligence oo yani qofkii aad attuned ahaan and subject kala waayo maninabi too much intaa galaba waxa raba intaa kuugu soo laabto maadaama dhahday are there people coming in. I wanted to make sure I answer that part for you because I am seeing a lot more Somali families seek out services because I think they're at their wits' end. They're tired and they're recognizing that there's way too many people wounded and there's so much experiences of sadness and trauma and all of that finally, again, it's not the same numbers that I'd like to see. However, it is much different than what it was about 10 or 12 years ago, right? And so to answer that, but the second piece you had talked about regarding like how is that spouse even going to know or even family members waxaa laga yaabaa miskiinta ayadaba intaana sheeganin oona ayna ka hadlin ee ku dhibnato because she's expected to hold the weight and she's expected to keep it together. Right. And so you're right. Somebody might not even be the spouse might not be even emotionally intelligent to even recognize that she's having a hard time. She might feel that she's not allowed to have a hard time. Because how would you know, like, if the expectations are, you know, you're a mom and you're supposed to be able to do this and that and the third, and you've never had postpartum depression and you've never heard of postpartum depression, and, you know, there isn't this, you know, relationship in the home that fosters probably some vulnerability. Again, I'm not making any kind of assumptions that there's no homes that don't have that. I think there's a lot of great homes that have it. But I also think that I would be remiss if I said that these are conversations that people have all the time, because that's not true.
But anaguna marxaladaasan gabdhaha ku furnaa. I don't know if you know.
Yeah, because waxaan arkay marka qaarkood aniga waxaan shaqo ku laakiin qaarkiis qofka gabdhaha marka uur kaleyn xataa waxaan arkaa diabetes ku dhacay qaarkood. Laakiin markii cunug ku dhasho uu baxaya. Marka waxaan qabaa inay hormone badan jiraan oo la fahamsanayn oo buuqan keenaya oo laakiin dadkiina aan la fahamsiin wixiina inta la isku dagaalay qofkii u dhaqmay si funny ah oo hore u dhaqmi jirin la waligeed qofka cunug ma dhalin moogta reer cusub inay laga yaaba waxa wadana meesha hadda ka bartay aniga
hadda dhama isoo bedelay waxaan rabnaa inaan waxyaabo ka weydiino mental health-ga so aniga waxaan rabaa marka koowaad Somali haddaan nahay mar walba waxaan maqlaynaa mental health-ga yaa qaba
iska waalba u noqonaa laakiin
maya markasta ereygaas aad buu u badan yahay isticmaalkiisa what is mental health
horta mental health waa iska erayo maskaxda caafimaadkeeda it's neutral mental health waa adoo dhahday caafimaadka maskaxda mental illness markaa dhahdid waa markaas
jirada maskaxda
jirada maskaxda iyo xanuunada maskaxda marka mental health
ereyga kala muxuu trauma meesha u socda way laakiin mental illness iyo mental health waa caafimaadka maskaxda iyo jirada maskaxda okay waxaan rabnaa inaan ka hadalno jirada maskaxda maxaa keena
waxyaalo badan waa question weyn laakiin waa isku khaldaya
waxyaabo mid baan u sharxi doonaa
when I talk about something big I want to make sure I do this like tunnel I always imagine this tunnel so when you think about psychological well-being waa another mumbo jumbo for mental health but waxay dhahaysaa psychological well-being waxa waaye qofkii yacni siduu u kooban yahay dhan intuu yacni dareemo wellness intuu dareemo marka psychological well-being like wax badanaa u dhaxeeyo wax badanaa ka mid ah psychological well-being waxa ka mid ah intaad adiga stay care gareyn kartid intaad validate gareyn kartid yacni emotionskaaga oo aad aware ka noqotid emotionskaaga intii aad identify gareyn kartid emotionskaaga intii aad isregulate gareyn kartid yacni psychological well-being waxa waaye saqshiyan bini'aadanka dhan wuxuu la dareenkooda wax kasta ay la dhiil gareynayaan waxay ka mid tahay how they're dealing with it marka waxaa dhahday mental health marka muxuu ahaa questionkaaga mental illness maxaa keenaa dhahda marka mental illness waxaa keeno markii aad overlook garaysid yacni aad overlook garaysid
aada ka
taxadarin waxyaalaha oo important maskaxdaada hygienekeeda so for example qofka hadduu yacni uu shaqo badan yahay for example yes waa la wada shaqeynaa hustle and bustle waa lagu jiraa maybe ilmihii 5 ciyaal 7 ciyaal baa korinaysaa 24 saac waa shaqeynaysaa manasitid mental health bay ka imaan kartaa meeshaas why because qofkii systemkooda overload ay samaysay right mental health meesha ka kale mental illness meesha kale ka imaan karta waxa waaye horta communities baa jiro oo ayakiyo resilient yacni anaga haddii nala fiiriyo oo Soomaali ahaan wax badan waa soo marnay maasha Allah wax badanna waan figure out gareen wax badanna waa ka soo يعني guulaysane waa ka hor imaanay maho laakiin anaga waxaan carry garanaa wax la dhaho dispositional vulnerability يعني waxaan already carry garanaa historygeena wixii u soo dhacay a vulnerability that if we have anything that overwhelms us or overstimulates us يعني the chances of us developing mental illnesses such as PTSD, anxiety and depression and all these other mental health issues shows that we are already a vulnerable collective that can feel that.
kugu jiraan waxaas already meel kugu jiraan.
Yes, why do kugu jiraan?
Because lama soo dhiil gareyn waxaan waa soo martay.
And the body keeps the score. So ciyaalkii oo dagaalkii markii uu dhacay aniga camal oona xasuusneen oo xataa laba waxay kala tahay explicit and implicit memory. Explicit memory which is recall, the ability to recall. However, there is implicit memory, which is in the body, right? So if anybody has ever experienced like these big, bad, scary things that are happening right now, like when George Floyd's situation happening, when there's a lot of oppression, or when there's a lot of racism. I mean, immigrant communities that come from war tend to be the first ones to be triggered. Why? Well, obviously, even African Americans, right? But the idea that you are coming from a place and it's starting to resemble
it looks like
a possibility
exactly.
of destruction and possibly that coming back, right? So what I'm saying to you is that mental health could also be, let me give you the textbook definition. Mental health can come out of many things that could explain or that could contribute to its existence, right? Environmental factors, which is where are people, like what are people dealing with? So for us, our environmental factor at the time was war, right?
Correct.
Here in America, it's probably poverty. It's probably violence. It's probably SA. It's probably domestic violence. It's probably all these physical abuse or dil وحاس, right? Exactly. So exactly. So environmental factors way ka imaan kartaa, and waxay kaloo ka imaan kartaa and big traumas like big events like world events that dhacdo, and يعني mana ku dhahoyo يعني laba qof oo xataa isku experience marto waxaa laga yaabaa mid intuu PTSD ku dhacdo midna intuuna waxna ku dhicin. So another factor that could contribute or that could perhaps explain whether somebody experiences a mental health issue or not is temperament, genetic predisposition, يعني qofka genes-kooda iyo qofka يعني dadnimadooda iyo dabeecadooda Ilaahay siduu u sameeyey dadaa jiro isla
resilience-iga ma adkaysiga qofkaas gaar u ah
exactly iyo dabeecad so maaha temperament waxaa laga yaabaa qof resilience-kiisa intay fiican tahay laakiin mid wuxuu haystaa temperament of like you know like I'm gonna fight this
way kala faith fiican yihiin way kala imaan fiican yihiin somebody wuxuu dhihi karaa inuu dhaho maaragtay they still believe that you know Ilaahay
yes
they have faith that waxaan khayraa ku jira you'll overcome some people there are many factors I get that
and you know what you're right but I like to avoid the whole thing about faith because I think sometimes what people hear when they say that is that they hear if somebody has faith that they're going to be able to overcome something but you could still have faith and have a system that is burnt out that it cannot overcome it. So you can be a person of faith, but still experience psychosis and depression and anxiety, right? But I will tell you that research shows that faith is a mediating factor for between quality of life and depression. So that means that if somebody is already high in faith, meaning if a person uses faith to overcome situations in their life, then they are better equipped to be able to deal with things because of their appraisal in the ways that they're going to be looking at it, right? Yeah. Whereas another person who doesn't have that may not have that appraisal to be able to focus on other aspects. Like faith tells you a lot what, like to
so that's why gratitude. You said this is huge. Many factors.
Exactly.
Now, marka tu hadda ku weydiiyey maadaama ay weyn tahay ku sii dheeraan waxaa aragtaa so far tan Soomaali ahaan maxaa noqosay qaybta
aniga waxay la tahay dhowr waxyaabo baa noqosay
qaybta mental illness
meelaha xusteeg mental illness waxyaabaha ka xustay waxa kamid ah I think trauma traumada anagu waa la dhil gareenaynaa laakiin dadkeena faham fiican kama haystaan so Dr. Abyan waxaan uga faa'iideysanaynaa waa maxay trauma
horta trauma waxa waaye if the word trauma essentially indicates a significant event that has happened in a person's life that alters their psyche, that changes the way that they think or perceive the world. And when I often tell people about trauma, I think waxaan ku dhahaa waxaad ka fikirtaa qof kaste haddii trauma ku dhacdo qofna the whole world feels like it's a scary place. Maybe they won't react that way to it. So trauma really is it's the response to a significant life-threatening situation. And so the way the person responds to that is an indication of how their system took that or the perceived sense of safety. Does that make sense? Okay, so trauma markii laga fikirayo and waxyaalaha qaarkood horta bini'aadanka maskaxdooda Ilaahay siduu u sameeyay always intaan yani aan waxaan doonno safety intaan doonno markuu yani events or significant events waxaa ka wadaa like dagaal ama qofoo biskoolad kugu soo qaatay ama tuugoo ku hor imaado ku afduubay yani cabsida aad dareemaysid cabsi oo aada ka soo laaban karin oo aad dareemaysid yani
naftaada khatar gelin kartaa
yes naftaada khatar gashay but also waxaa isbedeshay and icaawi perceived sense of safety within you
correct macnaha badbaadadii awal aad dareensanayd baa meeshaas la khatar geliyey oo la lululay macnaha naftaada waa u baqday
marka baqdintaas
lafaha u baqday naftaada u baqday
thank you so baqdintaas aad baqday it's a recalibration of your system where now you are oriented towards safety and not connection
so you are actually saying in computer terms it reboots your system
Yes, or it wires and programs your system because already traumadaas waxaad experience garaysa ayadoo adoo yar hadda community-gan camal ka hadlayno maanta adigiyo weyn maanta ilaahay kuguma dhacdo caliyo qof hadduu ku imaadan they try to mug you right and they put something in your head and they said hey give me your money right like at that moment you're right at that moment waxaa laga yaabaa from that moment and on you no longer see the world as a safe place right but imagine people who've had what we call this is complex trauma. A lot of big bad things happening over and over and over and over again. And so you're wired where you see the world from a lens that is that the world is unsafe, that people are unsafe, that situations are unsafe, people are not to be
so waxaa laga yaabaa waxay hore igu dhaceen anoo ka soo raysanaya muddo arkin hal mar oo saas because it's true aniga waa ku weyn Soomaaliya ku soo koray waa aragnay dhibasho mayd qori xarig waxaan soo aragnay now 30 years ka soo maqnayd like waxa leedahay wali meesha kugu jirtaa hadii qof intuu dhab isiyo gaas geliyo waxa soo xusuna tii Soomaaliya dhab
possible wali ba xasuus maaha explicit that's what I try to explain to people the part I want you to understand
the body's reacting to it
exactly so you were resilient amongst all the other stuff that happened because clearly you're living a functional life right
correct.
Clearly you're able to continue but it doesn't mean that when we have a good mental health it doesn't mean everything is 100% it means that you're functioning and if you're functioning usually that's success
correct
but waxa laga yaabaa
but underneath
things, yes if one or two things happen to you at this point that level of functionality that you've had and it might not happen to you but maybe you got your system is so resilient right correct. But I'm explaining to you how this happens
example
to them
easy and siinaba nina Mareykan saaxiibana askarta Vietnam aha Somali gay Baahanahay you know we went to getaway garowa ka soo falay gareynay couple of days later waxa imaanay xamar marka diyaarta xamar degaysay qofkii xamar yaqaan airport waxa ku wareegsan silig iyo bacaad jawaano oo bacaad ka buuxo oo loogu talagalay hadii la soo weeraro in isaga celiyo ninkii diyaarada ila fadhiyo waxaan arkay gudutay oo colorkiisa isbedelay saana u fiiriyay ana ayo okay ma jawaabaynin Terence alla saaxiibana 50 years ago buu ka soo degay Vietnam dagaalka soo laabtay 1971kii saana ahayd bacaadkii siligii Vietnam ku soo laabtay
yep
automatically he froze garoob عبار كده مركز ديارد استاكتي أو hotel تكونوا إيشة the whole everything that was in Vietnam my body showed that all these
أصلاً ما choose قراني no go he didn't choose
that it took over him
so سلو إيمانه تدوس choose قران how it comes
because we're intrusive how I that the way that our brain is made والله إلهي مسكح ونسي that its main primary focus is to keep us living so whatever it does to try to keep you alive, it doesn't necessarily think that it's a good thing. So when we are no longer in that, when we're no longer in that trauma, it stores it in ways where you can continue your life.
maalinta dhawaan sheekaysanna ka hadlaysa waxaad dhahaysa qaybta maskaxda iyo qaybtan waxa ku aasan yihiin goolka qaybtan waxa waa inay ku badbaadiso haddii khatar soo gasho
yes you're talking about the limbic system you're talking about the primitive system
tusaale waxa kugu ah weligaa jariirac markuu intaa meel mugdiga gashaa cabsi ma baqday ad ma doortay jirkaa la wareegahay bas qayb barigaa wuxuu rabaa inuu keep you alive laakiin real ma aha wixii cabsidii laakiin maskaxdii ma kala taqaano
exactly and what you're speaking to Ali is the limbic system and in the limbic system there's a structure called the hippocampus which stores memories and the incredible thing about our brains is that it has even a mechanism in which it stores traumatic memories and it stores regular memories. And so I imagine what happened for that young person is that those memories were memories that were stored traumatically. And so anything that looked like it, smelled like it, appeared like it. And so you know what happened then? You know the mechanism in which like all that came back up to him is that he was triggered by the familiarity of the place.
Exactly.
So people, place, and things could trigger memories of old trauma that he has no control over.
Even you don't even remember it in terms of but your body remembers it.
Absolutely not. In fact, I want to tell you a story. Does that answer your question?
Yep.
Because I was going to go give you one other example of like, I remember when George Floyd happened.
Correct.
It was the most strange, excuse me, not George Floyd, when the murder of George Floyd happened with that police officer. And mind you, I have no recollection of war. I have no recollection of the refugee camp except for like one event that happened, which was like a forest
fire. Or videos that you watch, does that count?
There is I don't even have videos. What I'm trying to articulate to you is the power of the mind. The only memory I do have was when we were in the refugee camp, there was a forest fire that had happened, and I don't know, I was like 2 or 3 years old, but somehow I ran away and somebody ended up finding me, but I have no other memories. However, when George Floyd got murdered and there were all those riots, out of nowhere, I don't know why, but I in the middle of the night, I started waking up grasping for air, which then at the time I was a psychology doctorate student, so I'm thinking, what in the world is going on with you? Like, you have no recollection. Mind you, I've not had anything. I know my body went through it, but I don't have any recollection, so I lived my life like somebody who's never witnessed any kind of trauma or something.
Correct.
Long story short, I do the work and I recognize and I see the similarities between where I was living and how there were, those riots that were happening by
Lake Street,
Hiawatha, and all those fires. Yeah. Well, I wasn't too far from that neighborhood, and all of a sudden, I was having those nightmares because my system, again, picked something up, even to a point of where the memory was explicit.
Wow.
Isn't that crazy? So that's how powerful the mind is, that you don't even necessarily have to have explicit memory. Your body carries the score. There's a book actually called The Body Keeps the Score.
Yep.
You guys if you get a chance, read it. But it talks about the emphasis about how even as children, we have to be very careful of what we expose our children to.
Wow.
Why? Because you think they're not going to remember. And Somali people always say this. ما حسوسنا وعيال iska dhaaf waa ciyaal kuma fahmaayo. But you guys, the children's system is always collecting what's in the environment, just like it collected when I was in that environment, because I don't have any memory of it.
Back to you.
This trauma thing, how it affects our relationships. Starts to feel trauma, it happened, right?
Yeah.
So how it affects our relationships, such as marriage friendships, trust, everything.
Yeah.
Sida u saameynaysaa trauma?
Yeah.
Many ways.
Many ways. Okay, so
use examples as much as you can.
Sure, for sure. So when we think about trauma, I want you to think about trauma impacts the very foundation of who you are. Talaba, what does that mean? Okay, so trauma waxay affect garaysaa, يعني waxay
dhammaan noloshaada oo dhan.
Thank you.
Yes, I save you.
Qofkaad hadaysaa.
Yes.
So ma hal meele everywhere. Shaqadaada, guurkaaga, noloshaada, relationshipkaaga, everywhere.
Yes, thank you. Waad mahadsantahay. So maadaama trauma affect garaysa the very foundation of you, who you are. What makes us who we are, markaanaga? What makes us who we are is our relationship. Somaha. What makes us who we are is the endeavors in nolosha waxaan galno. Somaha. What makes us who we are is the life that we choose to live. So when you think about trauma, if we trauma, how it affects you, well, waxaan also dhahay not too long ago is it orients you towards safety and not connection. So haddii aad tahay collective marka, or yani because of big bad things have happened, you have been oriented towards safety. waxaan ku weydiinaa intaan aniga su-aasha ku jawaabin ama ku answer garaynin, waxaad ka fekertiin haddii aad yacni tahay maxay ahayd bulsho oo dad badan oo collective drama soo maray oo orientationkiina ee tahay safety and connection, waxaad i weydiisaa muu malaysaa intii relationshipskaaga affect garayn karto?
iigu su'aal su-aashaas.
Haddii aad tahay collective oo aan already agree garayna intaad soo marta trauma iyo waxyaalo badan oo big bad things happen, oo haddana aan ka hadlana trauma intay tahay yani a mechanism in which your brain becomes wired and programmed and conditioned into safety and not connection. Do you think that in itself immediately tells you how it can impact relationships?
waxay u impact garaynaysaa maadaama aad dhahday jirka ka jawaabaya, the body response. Body safety baan laga hadlaya. Aniga safety ama nafteyda ha ahaato, ama lacagteyda ha ahaato, ama guurkayga ha ahaato, waxaa dhacaysa waxyaalaha hadda magaalada ku arko hadda macna ii samaynaya fahamsiinaysa in dadka wax yar ku kala boodaan because I'm triggered.
Thank you. Marka waxaad hadda
qofkaan ay dhahday iyo meeshaan ka jawaabay isma laha.
Exactly.
Because waxa waajaa qofkii meesha ka socod ma fahan.
I like meesha ka keenta kama keeni karaa. I don't really I did not. meesha waxa sida u saameyn karto no su'aashada I completely understand but sida u saameyn karto relationships-kayga
weli ma ada gaarin
I did not
it's okay wait sugo adi laakiin dhamayso please because I'm interested
hadii lagu yiri let's say Soomaaliya dagaalkii iyo dabkii markii aragtay George Floyd waa boodday soo maaha then safety-gaaga oo dhan iyo badbaadadaada oo dhan inaad safe tahay bay traumada affect garaynaysaa ani marka haddaa guri lahaa oo aroos dhigto meel deganahay oo all of a sudden aad wax yar i weydiisay su'aal nooc kale ah isla markiiba reactionkaygu wuxuu noqonayaa wax 10 times ka weyn exampleka diin ahaan u sharax waxaa ka mid ah ninkii markuu masaajidka soo galay ku kaadinaya waqti rasuulka sallallahu alayhi wasallam nimankii ulay soo qaateen they had their response but rasuulku muxuu dhahay let him finish kaadida ha dhamaysto because really he's whole wuu dhamaystiran yahay asaga kuwaan waxa waaye isla markiiba they triggered so waxa waaye ama that's why marka community inaad dhex gashid waxa la isku furay waxa dowladda booliiska la isugu yeeray waxa businesska ku kala dumeen inay tahay safety-ga naxa macnaha jawaabta aan ka bixinayo warniyo ani waxaas kama weydana dhahaysa gabadha all of a sudden muxuu isku bedelay ninkii because adiga waxaa tiri maaha meel baa riixday batankaas ay riixday baa buf meenada qariyay how do you explain that psychologically
so adiga sax hadda kuu fahmi kartaa su'aasha ku weydiiso waxaan ku weydiiyay maxay adiga kula tahay adna waxa igu dhahday you essentially said well I imagine that if somebody is oriented in I'm saying it I'm just paraphrasing but the way I understood what you said was if somebody's oriented towards safety then perhaps their bandwidth for being triggered or perhaps their level of regulation will be such that it is limited exactly it's going to be
there's
thin.
No space
exactly so what you're saying is then you're ascertaining that perhaps in relationships and in marriage there'll be couples challenges. Why? Because you have two people who probably have a very small level of right, but it's emotional regulation.
You're
it's
right.
your ability to hold on to very difficult emotions and still be able to function as an adult. And a lot of times it's waxaan dhahnaa waa xanaaqsan yahay it's waxaas waa dabeecadeeda ka tawa ka xanaaqsan tahay wax qof xanaaqsan ay duuyada jilay ma keenay hadda xanaaqsan tahay wax ka qaldan something's not okay because xanaaq should be even hatta haduu noqdo something momentarily a recovering wax la sameyn karo laakiin qofkan intay dabeecadiisa raacdo waa runta marka aan ku jawaabo marka the implications that trauma has on relationship is the ability to fully be in a relationship that allows you to not only feel safe, but also understand what is needed from you in a relationship when you're together, right? And so it's hard to offer somebody else what you may need in a relationship, if you've never seen it, right? In order for you to actually have emotional intelligence or a level of emotional intelligence that can uphold two people that isku jawabayo.
Correct.
يعني there would have had to be either يعني modeling of something that you had to go get other your adult وحي soo raadsatid because أنا waxaa dhahoya from a community standpoint early developmental and early childhood development which is the ages of 0 to 5 or even ages up until 10 years old waxaa laga yaabaa most of us dagaalaa jiray most of us dagaalaa jiray يعني أنا haddaan nii sheego the importance of 0 to 5 years old bini'aadamka u sameynaysa waxa waaye waxyaalaha ay ka mid tahay waxa waaye the sense of self the development of the sense of self waa qofka shakhsiyadiisa intuu ogaado who am I يعني how important am I to the people around me يعني who listens to me يعني do I have a voice marka aniga I imagine Somali horta waa ka horjeedaa intii la dhaho ma yaqaanaan ilmahooda loo koriyo don't you ever say that because that will make me upset it is that يعني awoodi ma lahayn if we people uprooted us from our country
correct
okay and they resulted in war and so there's many of us probably even people going well into their 40s laga yaaba oo wadankoodi yani kusoo barbaarmin oo familygooda household oo yani oo
caadi ma arkin walwad caadi ma arkin they never see normal
exactly so ayakoona normal ayan arkin bay haddana 0 to 5 waxay misgareeyeen the most important time where emotional attachment and attunement is so important and those things actually follow you in your adult years marka waxaad I weydiisay relationshipkeena sidee u affect garanaysaa we have been robbed of developmental milestones that are imperative for child development and so I say this now because as I'm learning and I was healing and doing my own work with this education I'm recognizing while I want to be frustrated with my people sometimes at certain things, it's such a disservice what's happened to us because of war. So the reason we're having issues is not only because of the trauma, but because we haven't even developed the necessary skills to be able to understand our own emotions.
So you're saying beyond survival,
somebody else's emotions.
So you're saying
survival,
and that's normal because according it's expected.
Yes.
So now my next follow-up question: the work door chairna watiri, and everybody will be inuu shaqada qabto.
Yes.
Do we all have to go to PhD? What are the steps no shake that we can start to heal and start to understand and open up and says, oh my God, we need to do this work.
Yes.
Okay,
my horta shaqadaas aniga dhaho markasta education kayga me because aniga education kayga experience.
How can we not in a little grain?
Dealinkaas loo soo
bilaabi trauma ku jirna bad.
Correct.
Ma ogidba. Waan runta anigana I reference my journey because my journey has taking me to a step where I started to appreciate therapy. And eventually therapy iga dhacday is what I'm saying. Like in PhD uma baahni.
Correct.
Meesha aniga waxa u jooga intaan dhaho intaan igana nii sheego. Why it's important.
Correct. Maxaa marka arka aniga? People my age and older, they see kufsi, they see mate, baabuur laga dhacay, qaarkood waxay dhaheen inagoo kismaayo marayna Kenya socon qofaa libax naga dafay. On top of the baabuur pickup car, libax came and ate one person and we left. There's so many stuff ay sheekeynaya. Ma fahant? Waxa la iska imaad inta shaqa la iska bilaabo. Don't worry about it. Waxaas ma nuur jiraan.
That's all. I feel like not only did you talk about all those things, but imagine in order for somebody to make it through life, they had to choose to not pay attention to it. If anybody had those kind of traumas, if the fact that you are trying to address it in and of itself could be something that could take away your functioning. So of course you didn't had focus on that because ilma kusugoy family lagu joogo Somali lacaga send out garane shaqadaada shaqaysane they Joyce ma lahayn luxury gana ma lahayn ma like in hadda meeshas ma joogno because taas waan fahansanahay.
If we have a choice, waxa leedahay marka imaan hospital baan aadi lahayn ba.
Yes. Why? Exactly.
Marka aniga noqon lahayn.
Exactly. No, aniga waxa badahooya yani ma aha wax oo yani that we should beat ourselves up for. In fact, if you see other communities, waxyaalaha anaga marnay imaata meeshan joogno. Alhamdulillah, Ilaahay like helped us a lot, right? But we have to also acknowledge that in the same ways that we have been able to be resilient, what was the cost of that resilience? The cost of that resilience was our inner selves. It was a very sad inside or an inside that nobody knows what they're going through. So me as the therapist has to be the one that sees people after people saying the same thing, only for me to recognize I needed to get brave and do something like this and talk to people to make sure I tell everybody, you are all experiencing the same pain. But you all do not want to talk about it. Why? Because waxaad ka baqaysaa hebel wuxuu dhahay muxuu dhahay community waxay dhahan right? So what I'm saying is, so for you asked me, Marka, how do we do this work? And honestly, the best answer I can give you, and I don't have a bone in me that can be performative. Ali, you and I have been in contact for I don't have the bone in me to be performative. But what I will say is that in order for you to do the work, you have to be able to acknowledge and validate your pain. But because we are always fighting, we're trying to يعني marabna inta acknowledge karayna so ilmaheena waa u diidnaa anagana waa isku diidnaa dadka dhibana waa yani wixii kama hadli karna qof kasta waxaad u jeedaa wuu u jeedaa qof kasta intuu hard gareyn karo pain iyo ku jiro because everybody cannot. First, they don't have the capacity. They don't have the capacity. So ayada badan u tahay ba qaaskood, okay? xumaanna kama aha bila aadannimo waay, okay? Qofkii haddii intaasoo problem la dhiil gareynayan intaasoo adduun ay Samena, you really think they want to stop and be like, they don't know how to do that because they haven't had enough to unload from themselves, Ali. You guys, they haven't unloaded, right? So in order for you to ascertain this help, first you have to acknowledge problem by haysta.
I have to expect her. I need help when I'm dealing with this. Okay.
Somalina maxaan nahay? Somalina waxaan nahay haddii aad wax haduu jiro ama wax oo liska weynaysay haduu jiro wixii waxaa barnaa inta dhinay gareen asagoo meesha joogo. So first you have to be aware wixii ceeb ma aha. Maanta day gacan ka jabto ma ceeb baa inta dhakhtarka aadin waa maya. weliba maanta haddii gacan kaa jirto ceeb maaha tii ilaahay, you're never going to internalize it. Like in the thing that every community does, and anaga naguma cusba, okay? Every community ku dhacday. In fact, American-ana hadda joogno everything normal ee tahay. Waabaa jiray oo waxaanba stigma ee ka ahayd. Like ayaga wen historygooda waa naga horeeyaan mogtahay. Like qof basta waxaad ogaanay at some point that you don't choose mental health issues. You don't choose mental illness, right? That it can happen to anybody because it's genetics, right? It can also happen to anybody because it can be genetics, it can be familial. يعني واحد ما تقيس وان ربا معها. So first you have to be aware أنا as a community. So the first thing we already talked about was وحي وانا أقادي that or وحي وانا يعني admit قريسي دا انتو جرو. The second one is يعني maskaxda هذا فور واحد أقادي like هدي science وقرنيا ودهايو when groups go through war traumas and there's histories of traumas and it makes a group more vulnerable. يعني ما حد why can we not see that المهني and raggi mamoyiki iyo 30 years later inta problem kan haysano why u haysan weynin? The research says that people
there's no surprise
there's no surprise.
The only problem is we're not accepting it.
Exactly. So anigana meel waxa taaganahay, and to be honest, I'll be honest with you.
Yeah,
there's once upon a time I didn't feel like I had the guts to say this in front of camera nor to say it in front of my community. But I think that I have gone through my own growing experience, and I've had to go learn the research and learn the science finally to be like, there is no way that you could be looking at the elephant in the room and everybody wants to act like there's no elephant in the room. The elephant in the room is that we're all in pain.
Wow.
And so when we are able to accept that I am in pain and that my child is in pain as a result of my lack of being able to be emotionally connected to them, and that perhaps because of maybe what's going on in my household and maybe the relationship or the lack of connection I have with my spouse and me and my spouse not really being connected in mihi mesha tawansina wate gerganana guri oo qurxana waa u dhignaayo sariir fiicanna way ku jiftaan laakiin ilmihi qalbigooda ma naqaano. Why? Because ilmihi ma naqaano sidaan ula hadalno. Aniga painkayga igu adag. So and you're not doing this because you don't like your kids. You're not doing this because you don't want to do it. You're doing this because it is psychologically normal human behavior to avoid. So until somebody gets to the point where avoidance is no longer what they're aligned with, or avoidance is no longer something that they're willing to do because it has cost them too much, then people decide and come to therapy.
Wow.
And that's where we're seeing a lot more people.
Wow.
Is because they finally realize I'm no longer choosing to be blind. And so therapy is going to help you. Therapy is not a magic pill either, you guys. Therapy is not a magical thing. I always tell people, don't come in here and expect to make me work magic. That's not how it works.
Yep, say it all, Manny.
Me.
Yeah.
Me.
I like that. So
they have
to do their work.
Yes. What is my role? Because I'm not the expert of you. You're the expert of your life. I'm the expert of psychology.
Wow.
And so what I bring is my expertise, clinical expertise, empirical evidence, all the information I have. Like in Aniga, you are my guide to you. So if you do not come in needing to do the work, there's no miracle I can work. And research also shows that talk therapy and medication goes hand in hand, but it's not always people start with medication.
So wait,
right?
Now I'm seeing something powerful. Abyan. Marka qaarkood waxaa isweydiiyaa painka waa arkaa. Somehow ilmaheena dariiqa taagan dhibaatadana haysata dadaa dhalay. Laakiin marka ummadda Soomaaliyeed dhex gashid dad xaflad ku jiraan u egnahay.
Yes.
xaflad baa socota intaa socota.
It's avoidant.
Inta xaflad lagu leeyahay Puntland baa socota cali gaashaan baa inta Puntland hebel baa maamul hebel baa dan waxaa isleedahay dadkan yaa dhalay ilmahan yaa dhalay dadka so ma fahamsanayn why qof kasta uusan uga hadlin cunuga daroogada cabaa cunuga xabsiga ku jira cunuga istaragal ku jira that when people come together masha Allah kala arag is waxa marka hadda kaa fahmaa waxa waaye
it's avoidance
waa total avoidance.
Yes.
So gorma la kacaya
when it gets
like we used to say in the business marki painke of changing the pain of not changing look greater than the pain of changing. When is that going to happen?
And I'm telling you, it's happening now. As much as you are still seeing this is happening, the increase in families who are choosing to like take their kids to therapy, who are choosing to finally come out and disregard perhaps what the community will say about them if they say something. There's many brave mamas and papas that are saying, screw it. I don't care what the community thinks. My child is suffering. And I'm not saying that it is happening to such numbers that,
but it's getting started.
But it's getting there because you're right. These events are still happening. But from a human standpoint, if you're invested in, if you're unaware of your pain and your system has cognitive dissonance that allows it to operate in such where it avoids whatever is the pain, then it makes absolute sense to me that you would be partying hardy and then you have all these other events as a way to keep yourself busy without feeling any kind of guilt.
Wow. So this is making sense to me?
Yeah. Okay.
This is beautiful. This is not making sense to me. We got about 5 minutes.
Hurry up.
Yeah.
Because we're going to forget where it was.
Wow. That's fine. We're not going to run out of talk. Abyan is ready. How much we miss Bafirne? Go back to it. This was beautiful, my man.
Did you at least get them?
I want to get all the way to the part. She says, screw it. I like that.
Yeah, I'm going to get my phone. I had a friend who was going to meet me there. Beautiful. Where are we? Did I get everything?
In the same way. No. waxaan sameynaa mataqaanaa ari.
Ha.
Codkeeda waa haynaa. So hawa kuma laabanayno.
Haye.
Okay.
Waxaa jira noocyada traumada sida emotional trauma, childhood trauma, PTSD. So what is it?
So horta the
Bal waxaad
trauma
noo kala sharxay kaliyihiin.
qofka so right. So markii trauma ka fikiraysid horta hore the big umbrella ka fikir just trauma. Trauma waxa waaye yani just the idea of significant events happening and the result of how the person responded to that trauma. Okay, it's not a diagnosis. Yeah, just trauma waa iska hadal. Markii lagu dhaho PTSD waa post-traumatic stress disorder. Just because somebody or many of us have gone through trauma doesn't necessarily mean that we are going to develop PTSD. PTSD is the response of how your system responded to the significant event or the life-altering event. Now, whether or not somebody develops trauma, that's temperament. يعني that's شخصية ودك waa kala duwan yihiin. waxyaalo badan way ku xiran tahay ku sheega qofka temperamentkiisa, qofka genetic dispositionkiisa, qofka historygiisa, wax badan ay ku xiran tahay. And marka but like qofka markuu PTSD lagu diagnose gareeyo waa qof oo yani. And remember how I explained to you guys trauma, how the brain has a particular way that it wires around safety, that anything that triggers it or anything that reminds the mind of a life-altering situation, it acts as if the response is something that's happening right now, right? So I want you guys to know the idea of trauma, or just how should I explain it? The idea of trauma, whenever a significant event happens, normally it is normal for human beings to react to that situation, to have a survival experience, and then go back, right? It's PTSD when the system can't go back. It's PTSD when the system got stuck. So that means now the system thinks everywhere it goes that they are dealing with the same threat. That's when it becomes PTSD. It's when the system does not recognize, and it's fine because also it's not like the person chooses. Remember, it is that just like your friend, he didn't choose to react that way, but because his brain wired in a way that never really brought the system back to its system of everything.
But I have a question on that though. Follow up on that. He did not choose.
Yes.
Yes. Lakin waxaan choose garayn karaa how I slow down on response. How I get myself out of the situation and respond garayo.
Yeah.
Does that make sense?
Yeah.
So I can choose that part.
And you know what?
About
and
that.
So what happens in therapy when you're being treated for PTSD is that there are different modalities that help you sensitize to the situation.
Modalities waa farsamooyin kala duwan oo la isticmaali karo.
Marka PTSD treatment maxay sameynaysaa? Waxay sameynaysaa systemkii oo wire gareysmay programming and conditioning markaan ku dhaho waa system hardwired right?
Well,
exactly. So PTSD is the response of not allowing your system to come back to safety. It's that your system hasn't had the opportunity. So what therapy does for you is it helps reprogram your brain to come back to safety in ways that it's not wired in now. However, there are people who experience trauma who don't have the same experience. They are quickly able to let it go.
But what are you saying now?
It's just different.
How therapists u sameeyaan macnaha hadda maad okay
terabiga qaabka u shaqeeyaan
no gaariga waa halaabay makaanigan keenay tuning baa lagu sameeyay waxa lagu soo celinayaa siduu ahaan jiray they know codka dhegeysanaan until it comes back, change this, change that, and then I take it. Now I feel the car is like when it was new. So now I came to you as a human therapist. How adinka u samaysin marka therapistigi in qofkii couple of sessions lagu soo celiyo meel uu wixii markay dhacaan still wuu dareemayaa laakiin jawaabtii waa isbedelaysa.
Yes, because had the awareness buu leeyahay.
Safe area la keenaya.
But like in Anisha, remember how we talked about the limbic system and we talked about the prefrontal cortex? Well, when you're treating trauma, you know that the person has an activated limbic system, which is the emotional parts of the brain that stores the trauma, right? This is the part of your brain that is much more activated, that actually causes your brain to shut down your prefrontal cortex because now you're in a flight and fight system, right? The idea of treatment is to decrease the activity, yes, while increasing awareness, which is the prefrontal cortex, right? And so through that work, you become more aware that what is happening in the room and what's happening in your mind are two different things. And so healing offers you choice.
Correct.
And that's why we talk about
basically
healing.
Safety, that's part of that talk is to make sure in a familiarization, that, hey, how should I begin? How should I begin?
Yes.
Yes. Because qofki marka conversation qofka la yeelanayo waa qof qualified ku ah. Because a couple of times anigan take it. That's what they ask you. Meeshaas ka hadal. Maxaa u tiri ku soo celi. That's 90%. Ana hadlo ayaga ma hadlaan, but they just figure it out.
So shaqadoodu waxay tahay qofka therapistiga inuu ku waraysto. Hay ii waran buu ku leeyahay.
Like maxay sameynaysaa? Waa ka hadalna last time.
Maxay sameynaysaa?
It's creating new neural pathways. You all might think it's just talk. But I'm very strategic in what you're being
making it
asked.
Safe. Yes. It's making it safe to go there. Basically, qolkan qol xiran oo lama geli jirin. Hadda isku dayna gishid aan dhahay. Hadda qolka tartiib loo furaa waa la galaa.
Yes. And it's before I even start to do some real work with anybody, they have to create safety. They have to check me out.
Yeah.
They got to be like, well, let's see how she's thinking. You know, most of the time I'm being checked out. I know that.
Yeah,
but that's because that's safety. And I welcome it, right? And I stay very, very transparent.
They trigger you.
Right. Or they don't even trigger me because I know where they're coming from.
I know, but they're trying to make you push any
they're
button.
Trying to see what kind of a therapist am I? Am I going to be somebody who really understands them? Am I going to be somebody who's judging them? Sometimes being Somali is really hard too because they have a preconceived notion. But alhamdulillah, I think we're starting to get out of that. A lot of people are recognizing, like, you know, therapists have obligation,
are you
licensure,
safe?
and things like that, right?
But how much I can tell you?
Exactly. So what I'm saying is, so somebody comes into a room, you create safety. And Ali, you know, we talked about this where you were like, you know, a few sessions. Sometimes it's not a few sessions. Sometimes it's like the first 6 months, nothing's happening because it all depends on that person's perceived sense of safety, right? So what I'm saying is, when the person is ready to do that work, there are strategies in which I use to extrapolate information and to create that safety and for them to talk about certain things. And I know that to the lay person that feels like, oh, but there is empirical evidence that suggests what psychotherapy does for the person's brain. And what we know about the brain is neuroplasticity and neurogenesis, which is the creation of new neurons and the creation of neurons and the creation of neural pathways, new neurological pathways. Yes, marka waxaad ogaataa talk therapy wuxuu sameynayaa qofkii waxyaalo badan baa jiro oo maskaxdiisa mayna process gareenin. And the reason ayna u process gareenin is because qofkaas at that time wuxuu ku jiray survival.
Yeah, no go area. I think you made it in aadi karo meeshaas.
Wuxuu at the time qofkii day survival uu ku jiray, so even wixii markuu dhacay wuxuu dhacay very quickly. So waxaad awoodaa waxaad ogaataa also waxyaaluhu qofka iska dhaadhiciyay or that has to do with survival intay distorted tahay. Why? Because a mind that is on survival is going to store things as it needs to, because at that moment you need to survive. So waxaan arkay a lot of people oo xataa yani markii ay traumadooda ay ka hadlaan yani information cusub ku soo baxa oo la taas ma xasuusneen intaas inta ahayd ilaan taas ahayd oo saas ma ahayd
connecting the dots now
because qofkaas maxaa ka tustay survival kii dhacay at that moment bay respond gareen, laakiin markii ay sheekadii ay ka hadleen ee wixii soo arkeen waxay ogaadeen maskaxdooda waxbay tustay. And at that time, anything why you're on survival, right? But you've been living your whole life, or you've been living experiences with a default and idea of what this world is, let alone you have not even processed what your belief systems are. You have not even processed your values. So
everything was happening so fast.
Yes.
There's no space to do that.
So and then you're living a life not even recognizing the values and the beliefs and the thoughts that you gleaned from this survival. Marka therapy maxay ku sameeyay? Therapy waxa way yani adiga yo yarn. Imagine a yarn, Ali. Okay, you're like a ball of yarn, and I gave you one side of the yarn and I told you to pull it. Literally, it's unraveling that yarn.
Yeah.
That's what it is. That's what therapy is. You're unraveling.
So waxaan kusoo gabagabeynaa adag ku siinaya.
Su'aalan siinaya.
So intaada gelin hal su'aal ku. So waxaan hadda ka fahmay inta ugu dambeysay. Aniga even though waxay cilada Soomaaliga soo dhacday. Halkan waxa ugu noolaan karaa like inaan Soomaali joogo.
Of course. By your belief system.
Your survival mechanism.
And how you show up in the world. The way that you show up in the world.
My survival success formula.
Yes.
Tii horaan wadan karaa.
Yes. In fact, wax kale aan ku sheego. You think that trauma only takes you down the bad route?
Yeah.
No, trauma can wire you to be an overachiever. Trauma can wire you to do the things that you do out of survival.
Not even knowing why, but you're driven.
Traumada marka waxyaabaha marka loo fiiriyo ma noqon kartaa cunuga yarkaayo kale hooyadiis ay ku dhihi jirtay doqon baa tahay inuu nacas baa tahay fulay baa tahay aabihii iyo hooyadii macalinka dugsiga ay ku dhihi jireen asagoo lama soo dhiilgareen dagaal iyo waxaas waxyaabahaas trauma ka noqon karaa.
Okay, so taas trauma lama dhaho laakiin waxbay tahay taas waxa waaye marka saan u hadlayay earlier wax badan aniga waxaan ka hadalnay ilmaha يعني markay soo barbaarayaan what is the development, what do you say that development koriinkoodana waxyaalo badanaa ka mid ah. koriinkooda waxaa ka mid ah yani saan hadda kuugu sheegayo 0 to 5 waxa dhaco cunuga dadnimadiisa, dareenkiisa, qofkuu yahay shakhsiyan, regulationkiisa, waxyaalahaas dhan waxaa development gareyso markii qofka uu ku jiro a safe healthy parental relationship maho. marka su'aashina is why weydiiso maha anigana always waxaan jeclahay intaan kuu reference gareeyo waxa dhacayo during those developmental periods for you to understand. iyo stage oo puberty stage kana waxa waaye 11 to about 17 so maho identity formation years maha. marka waxaad those two periods are developmental periods that are very vulnerable to anything that happens. So haddii aad haysatid waalid oona safe ahayn oo doqon kuugu yeeraayo oo yacni ku nitpick gareenaayo oo criticize gareenaayo maskax oo yacni hadda ay tahay maskax develop gareynayso ma laga yaabaa intay disho ma laga yaabaa
of course
okay ma laga yaabaa qofkaas intuu development gareenaayo yacni doubtkii iyo beliefka isku haysta dhan intay ka baxdaysaa qofkii dhan oo aamini lahaa wuxuu ku dhahay damiin baa tahay
qofkii trustiga u dhisi lahaa dilaya.
Exactly. marka trauma ma aha waa experiences that can shape the human. Their experiences that qofkaas hadda maanta shakhsiyan noloshiisa iyo mustaqbalkiisa iyo birita meeluu joogi doono yani significantly way affect gareynaysaa qofkii oo hooyadiis iyo aabihii oo yani primary caregivers or supportive ahaana ogow cunugaas intuu meel dheer aadayo compared to the cunuga kale, right? I mean, not to say we're resilient, you know, we get past through our challenges. Like in psychologically, the child who is being called doqon, the child who is being told waxna ma taqaanid oo la dilaayo oo lagu qeelinayo, that child is much more prone to experience psychological distress, and they might also experience mental health issues related to that. They might become anxious. They might have, you know,
identity already well shaped gray.
Exactly.
They think they're now they're not worth anything.
Exactly. And then you have a parent, but you also you have a parent who thinks that isn't going to make any, like that's not going to have an impact.
Yeah.
You also have a parent who says, anaga ba waan ugula soo dhahay waa inoo jeedaayo, anaga ba waan soo dilayo, anaga ba waan noo jeedaa. Ha, like imagine how much further you would be in life haddii taas lagu sameynin.
Also meesha adiga waxaas lagu sameynaya meeshaas ma laha. Labada wadan iyo labada environment way kala duwan yihiin. So waxaa laga yaabaa aniga wixii lagu sameeyey oo hooyaday samaysay. No, impactiga ay ugu yeelatay way ka yar tahay kan halkaan way ka yar tahay. Because xagga waxa waaye hadda Soomaalika marka la joogay inta halaabi kartidna waa yar tahay. Inta successful noqon kartidna way yar tahay. Labada way yar tahay. Opportunity-na waa yar tahay. Or there's not much high flight you can do. And impactiga waa yar yaho anoo dariiq iska maraya. It takes a village to raise a child. Adeerka soo rabaaxay, macalinka dugsiga soo rabaaxay, taliyaha booliiska iska ka soo kaxaysana. So you're not going to go far. But in here, the impact is huge.
Right. So what you're saying is the support system was much more bigger. So in other words, if somebody did something, you had so much of a support system that it didn't really take that much of an impact on you.
Like inta meel faari aadi karaan. You know, waxbay dili karaan, cabsiyada dheeri geli karaan.
Yeah, but we also have to understand, you guys, the kids that we have now are not the kids that, you know, back in the days were.
No.
Like from a social standpoint, حتى like shakhsiyan dabeecadnimo waa la kala duwan yahay.
Hatta warunta dadka Mareykanka inta ugu imaanay kuwii 1980s-kii 70s-kii koraay kuwa inta koraay isma laha.
Different people.
No, always bini'aadamka
groupka ugu dambeeya.
Always deegaanka way bedelaa bini'aadamka.
Maya tacbaan waa deegaanka groupska hadda u dambeeya. Resilience way liidataa resilience.
Here's what I will say. What I will say is I understand that it can look like resilience way leadata from the outside. What I know to be true. What I know to be true is that, you know, second generation immigrants, children of immigrant, they are tasked with things that are very different from 1.5ers and first generation. And one of them is that identity. And so you can imagine while we didn't have much like language and we had to figure out and the parents had to figure out all these things, right? You all were tasked with making a life for yourself in this country.
Yeah, making America work.
Out, right? But your identity was solid.
I think I have one problem. I wanted to make America work, but I knew who I was.
Yes.
They can figure America out, but they don't know who they are.
Exactly. So what you're seeing that looks like not a lot of resilience is not that. It is that you have a generation tasked with a different set of challenges than the first generation because they have to deal with identity. And so I want you then to really think about, yes, we had it hard, or and I go, I'm in the middle there. I just got a little lucky, right? But even first generation, you know, figuring out money and opportunities is challenging. Don't get me wrong.
Life.
But if from the inside you are not solid, and then you have parents who have not dealt with their own trauma, who expect you to do X, Y, and Z when you don't even know who the heck you are, I mean...
It's so true.
It's a pretty challenging
situation. Waxaan rabi lahaa inaan dhaho caaway wax weyn baa meeshan ka dhacay mahad aad iyo aad waxaan ku faraxsanahay bahda Moon iyo ummadda Soomaaliyeed especially reer Minnesota inay caaw u helaan inay glimpse ka dhageystaan Dr. Abyan Bashir and how passionate ay uga tahay subjectigan and I think waa very few su'aasha dambe ugu dambaysa hadhow ayadaa ka jawaabi doonta u malayn maya hadda psychologists ka Soomaalida ama therapists magaaladan jooga I don't know how many are they and waxaan rajaynayaa laakiin waan rabi lahaa inaan kuu soo gudbiyo in maaragta caawa waqtiga nugu yar dartiisa la sii wada hawshaan and I believe in dad badan oo nooc fikirkii oo kala qaban la helayo in maaragtay more and more questions and answers in loo gudbiyo Abyan hadii ilaahay kuu roon yahay. Back to you.
May waa intaasaan kusoo gabagabeynaynaa su'aaluhu isku xiran yihiin waxaan rabaa inaan Abyan weydiiyo second generation immigrant oo kale sida u saameynayso traumadu iyo
su'aal weyn waay
dib baa u dhigana iyo sidoo kaleeto traumadu keeni kartaa depression iyo anxiety iyo waxyaabahaas marka barnaamijka xigaan ka dhigan doonaa
absolutely powerful aniga personally I don't know dadka fiirsan doona laakiin wax badan aan bartay wax badan aan ogaaday and I really love Abyan's Dr. Abyan Bashir's passion about it and wax badan waxaa kaloo aad aan ugu faraxsanahay maaragtay markii ugu horreysay oo aan arkay yes mara badan macnaha qof Soomaaliyeed oo doctor ah oo professional therapist ah oo dumar ah ma fahanta waa ku arkay marka laga reebo siyaasiyiinta badan dumar badan ma imaanin showga caawa aad u faraxsanahay inay maaragtay rag iyo dumarba laga wada heli doono barnaamijkan
Moon Media.
Thank you for coming.
Thank you for coming, Abyan.
Thank you guys for having me.
I love it.